Hello friends, as you all are aware that HMPV virus is getting its surge in China and a few parts of our country also. Myself, Dr. Dean Yadav, a practicing homeopathic physician in the region of Greater Noida. HMPV, that is to say, human metapneumovirus. The human metapneumovirus mostly causes respiratory infections similar to influenza virus and RSV virus, that is to say, respiratory syncytial viruses. HMPV primarily affects the respiratory tracts and it is mostly prevalent in young children and adults, older adults of 60 to 65 years of age and above. Now we will talk about what are the symptoms that we are seeing across China and different parts of our country. The symptoms of HMPV can be broadly classified into two groups, a mild group and a severe group. If you talk about the symptoms of mild symptoms of HMPV, it can be runny nose, cough, mild fever, fatigue, sore throat. And as far as severe symptoms of HMPV are concerned, it can be a high fever, wheezing, chest pain, and pneumonia. Now, we will talk about the cause of HMPV. The HMPV virus is not a new virus. It is an old virus of the family Paramyxoviridae family, and it mostly affects the respiratory tract of our body. It generally spreads through respiratory droplets, contaminated surfaces, and contaminated secretions. It also spreads through contaminated people. That's why the most vulnerable group which can be affected by HMPV are the young children and the older adults above the age of 60 to 65 years of age, and those patients with weak immunity. Now we will talk about the risk factors and the vulnerable group. The risk factors are always the younger adults and older adults above 60 to 65 years of age, and people with weak immunity or with a chronic disease of lung and heart, and also taking immunosuppressive drugs for a longer period of time. What are the complications that HMPV can cause? HMPV can cause serious complications of respiratory tract, like it can aggravate already existing asthma or COPD. It can cause severe chest pain. It can cause severe respiratory distress. So friends, I would like to request you all, do not get panic. It is also just like any influenza virus or RSV virus. And its symptoms, whether mild or severe, can be easily treated with homeopathic medicines. Now, I would like to suggest you certain remedies which can be of very use in cases of HMPV. The remedies generally which I am prescribing in my clinics nowadays are arsenic album, phosphorus, aconite ferox, carvovage, hepar sulf, ipecac, spongia, belladonna. Friends, not only the treatment part, homeopathy has also a prevention for HMPV also. So it's my personal suggestion, do not rush to the hospitals or do not rush for vaccination for HMPV. Once again, I would like to say, do not get panic. Take the best care of yourself and wish you health and happiness through homeopathy. Namaskar.